Good afternoon, everyone, and thank you for joining us today. My name is Karen Brownlee, and I am the Adult Program Coordinator at the North Suburban YMCA in Northbrook, Illinois. In that role, I bring a variety of programs to our community, including social networking opportunities, a caregiver support group, brain games, and the YMCA Education Series, which you are attending today. It is my pleasure to welcome you to Low Back Pain and Sciatica, hosted by Denise Schwartz, a physical therapist and the owner of the Manual Touch Physical Therapy. Denise has been a licensed physical therapist for 25 years, and in 2010, she opened her practice in Wheeling, where she combines experience, education, and different therapeutic techniques in a whole body approach to create unique manual therapy and exercise plans for patients to reclaim function, life, movement, and enjoyment of the activities they love. Today, Denise will be specifically addressing low back pain and sciatica because those two combine to be the #1 reason people visit a doctor. And with the current opioid and painkiller epidemic, she wants to help people heal naturally. Denise will also cover the 3 main causes of low back pain and sciatica, along with the #1 mistake that people make when dealing with low back pain. Denise has been a part of the YMCA Education Series for going on 4 years now, and we are so glad that she is continuing to educate our community through this virtual platform. The YMCA Education Series is free and open to the public, and as a 501c3 charity, we do rely on fundraising to help us serve the community. If you enjoyed today's presentation and want to help us continue to offer free programs like this, we welcome your donations to the North Suburban YMCA. You can visit our website at www.nsymca.org to donate and see all that we are doing and planning. Enough about the why, enough about me. You came here today to learn more about low back pain and sciatica. So with no further ado, I give you physical therapist Denise Schwartz. Thank you, Denise, and I will let you take it from here.
Thank you, Karen. It was a nice introduction. I liked what you came up with there.
Thanks.
Okay. Sorry, I'm kind of playing around with the screen here. Okay. Everybody can see the screen okay?
I believe so.
Well, I guess it's not morning anymore. It's lunchtime. Thank you for
Works.
joining us. And thank you, Karen, for having me. I really appreciate it. And let me know if you can't hear me. Maybe put it in the chat box if there's a problem. If you have any questions, put that in the chat box and we'll address them at the end of the webinar. But first, I'd like to start off with a little bit of a contest here. What I'd like you to do is in the chat box, you can put an answer to this question and put your email there as well. You got to have your email, otherwise you don't get part of the I want to call it a grab bag, but what's it called? Raffle or whatever. Anyway, for a prize at the end. Okay. So what is the #1 reason people go to see their doctor? So while you guys are mulling that over and putting it in the chat box, and Karen will keep track of all that, I thought I'd fill you in a little bit about myself. As Karen says, my name is Denise Schwartz. I'm a physical therapist, and I guess I've been doing this a while now. So she said I've been doing it for 25 years. I'm actually at over 30 years now, so it's been a while. I started my career at Lutheran General Hospital in 1988. I saw lots of different kinds of patients in the hospital until I started specializing in outpatient, which is what I do now. I have my own clinic here in Wheeling, the Manual Touch Physical Therapy. I'm in Wheeling at Milwaukee and Dundee. And while I was at the hospital, you finish school and you take a lot of continuing education. And I took a lot of back pain classes to become an expert in back pain and sciatica because that was the majority of the people that we saw. And I became a really good expert in treating people with some traditional physical therapy techniques. And down the line, I don't know, maybe about 10 years in, I started studying some non-traditional therapy, which would be with hands-on work, where I use my hands on people and look at them as a whole picture. And I found using these non-traditional techniques that I could get everybody better. Whereas with my traditional techniques, I couldn't get everybody better. So I went down and became an expert in this non-traditional therapy. I got a certification in it. It's called Integrative Manual Therapy. I left the hospital to start the franchise of the clinic here called Center IMT. And I worked there for about 7 years, working with a lot of very complex patients who just didn't get better elsewhere. And then it's now 11 years ago, we parted ways, and I took over the practice here in Wheeling, and I became the manual touch physical therapy. And what I found was I missed some of those traditional things that I used to do. And I brought that back in, and I combined my practice using traditional and non-traditional therapies to get people back doing the things that they love to do. Along the way, I had developed a passion for running. And again, I went to many classes and read a lot of information and became an expert in treating runners. So I have a sort of a subspecialty with that as well. I have recently taken a golf class, and I see people with balance issues, strength issues, back pain, all sorts of pain issues. But for the purpose of this webinar, we're talking about back pain and sciatica. All right, so hopefully everybody put an answer into the chat box. It was actually an easy question because Karen gave it away at the intro. And then I don't think I said it there, but the answer to the #1 reason people go to see their doctor is low back pain. So that was why I went to all those classes to get better at it and become an expert in it, because everybody needed it. Everybody has a problem with it. So before the pandemic, we used to do these seminars in person, and we could have a lot more interaction. And here's the point where I would ask you, what are your common complaints for back pain? But I found when doing this virtually, it's a little challenging to have people call out answers, etc. Particularly since we're recording and we don't want your face on the recording. So here are some common complaints that people tell me with their back pain or sciatica. And these complaints are very important. This is really important information for me as a physical therapist and your doctor, because it really helps us sort of discern what's going on and lead us down a path of what we think might be the problem is. And it's very important to figure out where the problem is coming from, because the treatment is different for each one. There is some overlap, of course, but in many cases, there's some exercise that we might do for one problem we wouldn't do for another one. So I get people who come to me and tell me that their back pain or their leg pain, which is sciatica, hurts when they walk or stand. That would be one diagnosis. And then there's people who say it's when they bend over or sit. So the people where it hurts when they walk, usually feel better when they're sitting. People where they say it hurts when they're sitting, it feels better when they're walking. So we know that there's something different there. Some people only have pain when they transition from movement. So going from sit to stand or getting in and out of bed. Some people have pain in their leg. Some people, and no pain in their back. Some people only have pain in their back, but nothing in their leg. And they could have it in their leg anywhere down the leg. It could be in their buttock, the back of the thigh. It could be in their big toe. And that also tells us some things. Some other complaints that people will tell me, it sometimes feels like their back feels like it needs to crack. It hurts first thing in the morning. When they get out of bed, they barely can walk because they're so bent over. People complain of back stiffness. Another complaint of sciatica is numbness or tingling somewhere in the leg or foot. So sciatica can be pain, numbness, or tingling down in the leg anywhere. So here is a picture of an ebook that I offer you. Again, if you'd like this ebook, this will teach you how to take care of yourself on a daily basis. So put your email in the chat box, and Karen will get that to me, and I can email you this ebook for you as a thank you for coming here, and something that you can take care of yourself. Okay. So we're going to talk about the 3 most common causes of back pain that I see. There are other causes, and some of that information that you tell us will tell us if it's one of these 3 or is it something else. Okay, we'll talk about that later, how we discern that. So the first most common cause is a herniated disc. People sometimes call it a slip disc, sometimes they call it a bulging disc, but they're really all the same thing. And people with this problem have pain when they bend over or with sitting. They may hurt when they sneeze or cough. And sometimes people, they get this injury is caused from sneezing or coughing or bending over to pick up a golf ball. This is where I get a lot of younger people who have a dog and they're always bending over and taking care of the dog. And their body is just not ready for it. The second most common cause is a form of arthritis called stenosis. And this is a narrowing of the spinal canal. I'm going to show you some anatomy pictures and we'll go over this again. This is also known as degenerative disc disease, arthritis, degenerative joint disease. So your physician or the radiologist who takes an MRI, that's how you officially diagnose stenosis by a picture, is with an MRI, may call it any of those things. And these people have pain in their legs when they're walking or standing. They might have it in their back or their leg pain or in their legs. So these are the people, you know, as you get older, you get arthritis, you get degeneration in that spine. So it never goes away, but we learn how to manage it and take care of it. So I usually see people with this, they'll come in once a year, they'll have a flare up. I had a patient just recently who came in, he was really in a lot of pain in his back. We did some manual therapy on him, got him moving again, and within a couple of visits, his pain was under better management and we could do some more exercise. The third most common cause is sacroiliac joint dysfunction, or SI joint. And I'll show you in the picture, here's the spine. This is your spine, and this is your pelvis. This right here is your SI joint. This bone is called your sacrum. Down here is your tailbone, your coccyx. And this is the ilium of your pelvic bone. And so that becomes your SI joint. When people have a problem here, they tell me that it hurts when they lay on their back and it just feels stuck. And actually, a lot of times people complain of walking because it hurts when they stand on it. I have a guy right now, he's 47. He said he hurt his back when he was a teenager, and he's always had pain in this SI joint. He has seen me for some other issues, but this was one of them. I worked on him one time, actually, and with my hands, and he hasn't had pain here since. Now, mind you, he's had pain here for 30 years. So he's had therapy before, but everybody sort of does things a little differently. That manual therapy coupled with the exercises he's doing is actually really fairly pain-free in his back right now. I include kind of a fourth common cause. These are medical diagnosis. This would be more of a physical therapy diagnosis that we see with everybody. Everybody who has a back problem will have postural weakness and usually some form of immobility or inflexibility. This is really, really common right now because so many people are sitting because they're working from home. So I'm seeing more people with this problem because they're sitting at home and they're not sitting in their desk chair that they had at work. They're sitting at the kitchen chair, they're sitting at the couch, they're sitting at the kitchen table, and not with good posture, and they're not using their muscles efficiently and ideally. And so they start getting upper back pain, they get mid back pain, they get low back pain. My neighbor came to see me recently. She's, I think they're 55 or so, and she's working from home, didn't have her desk chair, sitting at a dining room table chair, and she was having pain in her back. She came in, I did some manual work. I taught her how to fix her posture. I gave her some exercises. She got a better chair, and She's 2-3 weeks later is feeling significantly better and not having that pain anymore. So let's take a look at what's going on in your spine. Karen, is this thing in the way here? The sharing sign here?
No, I don't see a sharing sign. No, not
okay.
for us.
Okay. Sorry. Thank you. All right. So, this is your spine from the side view. This is a vertebrae. This is a vertebrae. Okay, so those are the bones of your lumbar spine. There are 5 lumbar vertebrae of your lower back. Above the lumbar spine, you have your thoracic spine, and there's 12 vertebrae there. And then above that is your neck, which is known as your cervical spine, and there's 7 vertebrae there. Below the vertebrae, you have your sacrum. And in between each vertebral body, this is the body of the vertebrae. This is the inside of your body. This is if you're looking at your back, okay? In between each segment is your disc. Through each vertebrae, there's a hole that goes down, that your spinal cord goes down. And then there's another hole where off of the spinal cord, a nerve comes off. And they go to the rest of your body, okay? My next picture will show the sciatic nerve a little more. I want to talk about this disc. The disc is like a jelly-filled donut. In the center of this disc is a nucleus, and that's like your jelly, okay? So you got your disc and the jelly donut in the middle. And what happens when someone herniates their disc, or they have a bulging disc, that nucleus kind of shifts and pushes on the outside of the disc. And then that presses on a nerve. And that's where you get the pain, okay? Well, that's one form of the pain. You get some nerve pain. The other type of pain that people get is when your body, you herniate a disc, you slip a disc, or you have a major stenosis flare or something going on in the spine, your body wants to protect it. And in order to protect that, your back muscles that are surrounding the vertebrae go into spasm. And they create a kind of like a corset around your body. It kind of squeezes you. It's your body really taking over to protect what's going on underneath it, okay? So those spasms are actually very helpful. It's our body's intelligence taking over to protect our spine from getting further injured. So now this is what we call a posterior view, or the back view if we're looking at your spine. Here's your lumbar spine. This is your pelvis. Here's each vertebrae, okay? Here's that sacrum. And I showed you this before. This is the sacroiliac joint, okay? And then out between each segment of vertebrae become nerves. The largest nerve in your body is your sciatic nerve, and it comes out of L4-5, L5-S1, and out of portions of the sacrum. And it comes together to form this very large, thick nerve, and it runs down the back of your thigh, and then behind your knee, it splits into 2, and it goes down to the outside of your foot, down to your big toe. So you could have weakness, pain, numbness, tingling all the way down into your foot. When someone comes to see me and their foot and their ankle is weak, they can't lift up their foot, or they can't lift up their big toe, that's a pretty serious condition where that sciatic nerve is really being impinged significantly. Those are the times where we're going to make sure you get back to the doctor, because you might need some medication or some other, medical intervention. Now, with that being said, I have seen people where they have weakness in their foot, and through physical therapy, they do get better and they get the strength back in their foot, and the numbness and tingling and pain do go away. Okay. Something you should know that I find that I observe very interestingly, even though if somebody has a herniated disc up in here or stenosis, I would say 9 times out of 10, they all have an SI joint problem. My theory is when their body gets into a flare-up or an acute episode of back pain, not only does their back muscle spasm to protect their back, you start walking a little funny and then things get a little out of whack down in here. So this tends to be pretty acute pain. So when people first come in to see me, we'll work on mobilizing this joint to get this in better position, better mobility in there. And that'll take away quite a bit of their pain, and then we can focus on what we need to do up in here. Here's some information about the sciatic nerve, which we talked about. Again, if you put your email in the chat box, I can send you a copy of this PowerPoint, which will have all this information in it. Plus, I'll send you some ebooks as well. We talked about briefly in the beginning, the reason we want to know what's causing your pain is it will tell us how we're going to treat it. Of course, there's some overlap, but the exercise I give someone with stenosis isn't what I'm going to give someone, a very specific exercise, what I would give them for stenosis I wouldn't give for herniated disc. And it might not be for somebody who has osteoporosis. That's a whole nother monkey wrench that gets thrown into there. So someone who has osteoporosis and stenosis, the exercise, the basic exercise treatment are complete opposite. So we have to keep that in mind. And that's why we don't do exercise classes, general classes for back pain, because everybody is different. It's really important to be very personalized in this case. All right, so how do we know if physical therapy will help? What we want to know is your pain reproducible. So if someone comes to me and says, it only hurts when I stand and walk, and when I sit down, it goes away. Or I sit down and it hurts, but if I stand up, it goes away. So what isn't, and then we know we can help you, but what isn't reproducible? So I don't know if there's anybody on here who's heard my story, but here's a story that's now 4 or 5 years ago. I got up, I was going out for my morning run, and I noticed I had some low back pain. And I'm not somebody who has low back pain. I'm really fortunate. I've never had a back pain injury. I got, I should say, a little bit of SI joint problem. Oh, when I was pregnant, I had problems with my SI joint. That went away once I delivered the baby. But that's very common. At any rate, I'm not somebody who has back pain typically. When I was in PT school, we really learned how to use our body so we don't hurt ourselves. And that's the knowledge that we're imparting on you. Anyway, so I went out for my run and I had some back pain and thought that was odd. I don't remember lifting anything or doing anything out of ordinary, but it didn't bother me while I was running, so I kept going. That was a Monday. By Tuesday, it was getting a little worse. By Wednesday, it was really pretty bad, and it was starting to go around to the front of my abdomen, around my hip. I had a friend, another physical therapist, work on me. It didn't help. That evening at 2 in the morning, I woke up and I couldn't find a comfortable position to sleep in. By Thursday, it was even more worse. There was no position that was comfortable. Nothing made it better. Nothing made it worse. It just was bad. And because it wasn't reproducible, I said to my husband that Thursday evening, I said, I have to go to the hospital. There's something else wrong because I can't make it better by sitting or laying down or doing anything. So I went to the hospital because it was in my low back. They immediately thought of a kidney stone. They worked me up for that. They did a CAT scan, ultrasound, etc. But I went in and I said, it's not reproducible. It's not musculoskeletal. Well, after whatever test, by 2:30 in the morning, like, we don't know what it is. It has to be musculoskeletal. Here's some Vicodin. I wasn't ready to argue. It was 2 in the morning. I went home with pain meds, and Over a couple of days, it got better. By the following Tuesday, so this is now 8 days after the initial pain, I scratched my back and I felt a rash. So I had shingles, but I had pain before the rash showed up. And so it's very difficult to diagnose. You know, doctors aren't looking for the zebra, they're looking for the obvious. So are we. It was in your low back, must be kidney because that's where they are. It wasn't reproducible, so it's not musculoskeletal, but then they were at a loss. So anyway, shingles, you can have pain before the rash. And that was my case. So in that case, physical therapy typically does not help. I do find because shingles affect your nerves, that is nerve pain. There are non-traditional therapies that are helpful for nerve pain in addition to taking the antivirals. So I did some acupuncture, and then some of the manual things that I do, some of the non-traditional is helpful for that pain as well. So here are some nice, people gave me some nice reviews, gave us here, I have another therapist here, Kevin, and when we both treat back pain, here's someone, helps to heal someone's back pain has been bothering them for years. She really appreciated the app that and videos that I have to offer people. So if you come to see me and you have a smartphone or a computer, I can give you an app where I put you videos of your exercises on there so you can see them. This woman says that she had hurt her back a number of years ago and went to PT for 7 months, and she came to see me and we were done in 5 visits. So I love here that she says, every time I unload the dishwasher and use the proper posture to protect my back, I think of you. I have been told that many times. People hear me in their head. I don't like my voice. I apologize that if you have to listen to my voice, but it seems to help. It's really funny when I go to a networking meeting, which of course we're not doing in person anymore. When I start to talk, everybody sits up straight. One of the things I offer is a free phone or telehealth consult to discuss what's going on with you and let you know what we'd recommend, what we think would be best. So please feel free to do that and reach out to me. I'd be happy to talk to you. Kevin will talk to you. My admin, Jenny, can talk to you as well and let you know what we can do for you. Okay, here's the next question. What's the #1 mistake that people make with sciatica or lower back pain? So put your answer with your email in the chat box. I'll give you a few minutes. Well, maybe I'll give you a minute. So people ignore it. They think, oh, I'll just get better over time and we'll just see what happens. What's unfortunate about that, 9 times out of 10, this can set off other issues because you might be protecting it. You start developing compensation or it gets worse. Other things that people do is they'll take medications or they get injections or ultimately might have surgery. There is a place for this, okay? I am not against any of those things. Hopefully, what we'd like to do is really handle the situation, have you come into physical therapy, really teach you how to take care of your back, how to protect it, do some nice manual therapy where we do hands-on care, teach you the exercises that you need. Oftentimes that's in conjunction with a medication. People who have an acute flare-up of a herniated disc might need what's called a medral dose pack, which is some steroids. And that will bring down the swelling in the disc and the pressure on the nerve and the nerve irritation. And then we can really work on strengthening your body, get your body working together. What we call neuromuscular reeducation, teaching your body, your feet and your hips and your core and everything working together. When you go to reach for something, you want to make sure you're moving through your body. Do you need something in your shoes? Do you need better shoes? I tell the story of I had a young girl, 14, and she had a significant jaw problem. Ultimately, she really had a serious autoimmune disorder was she needed jaw surgery. But in the meantime, when she came to see me, she kept moving her mouth around because she couldn't find a comfortable position. And she particularly did this when she was in standing. When she was sitting down, it wasn't as bad. And her feet were really weak, and so was her core. So we needed to get her some good shoes. She needed some orthotics. She needed some strengthening exercises for her core. We had to do a lot of her exercise in sitting until she could do it in standing and stabilize. And then she could actually find a somewhat comfortable position for her jaw. So that's a story of how the top of your body could be affected from the bottom of your body. So we want to look at all those things. All right, so we talked about you're going to learn how to take care of yourself, some posture, how to move throughout your day. You're going to get some exercises to strengthen your body, particularly your core, your abdominal, and your back, improve your mobility and flexibility, and work on your balance and stability. We'll do some hands-on work, and then most importantly, teach your body how to work together, really get it re-educated. Here are some nice other testimonials of people. Here's a woman who said her epidural didn't help her. I don't know if any of you have had an epidural. Sometimes it helps and sometimes it doesn't. And doctors will tell you that. It's kind of like steroids. Sometimes it helps, sometimes it doesn't. And so she came in to see me and she felt so much better. What'd she say here? Now she can get in. She was having trouble getting in and out of the car. And now it's not a problem. Here's someone who had back pain for 20 years, off and on. And whenever she has an acute flare-up, which has only happened twice here, she comes in to see me. And I think, if I remember right with this woman, it would take maybe about 3 visits and she'd be back on her feet without a problem. So what can I recommend for you? We talked about how I don't like to give out real specific exercises because I want to know what's really causing the problem. But there are some generic exercises people can do. Again, I'm not going to go over those today. You can find some of those on my website. But mostly, you just need to keep moving. You don't want to sit all day. Get up and move every hour, hour and a half. Walk around the house. Walk sideways. You know, I tell people every time you go to the bathroom, walk sideways to the bathroom. Really pay attention how you're moving throughout the day. Now, unfortunately, I do have some people. We had a man, 88 years old. He had a really horrific accident when he was a young man. And now his back is really just very challenging. He's very weak. And so for someone like that, sometimes we just have to stay in a position that doesn't hurt you and give them as much strengthening and help and support that we can. Okay. All right, here's another reminder to put your email in the chat box so I can send you this ebook on how to take care of yourself. I think I sent out a couple of other ebooks, one on balance, one on, actually one is specifically low back pain, and this one is a very general on how to take care of yourself all throughout the day. Okay, and again, if you'd like to have a consult with me, let me know, give me a call, and my admin, Jenny, will set up a meeting with either me or Kevin, and we'll go over what's going on with you and yet let you know what we think you need to do. Okay, and I'll also send you a copy of this PowerPoint. Okay, I'm going to stop sharing this screen so we can go over any questions you might have. Any questions in the chat box, Karen?
Let me see. Really, people were just giving me their information, their email addresses. Okay. But I have a question.
Okay.
So when you advise that people walk sideways, is that because we spend so much of our time with our hip flexors shortened and our hamstrings shortened when we're sitting, and then every time we walk, you know, every step we take, we use our hip flexors and our hamstrings to go forward? Is that why you recommend people walk sideways?
That's actually one reason. So when we're moving, and I think what Karen's pointing out is we move forward, okay? That's one direction. You're using your muscles going forward, but all the muscles around your body, around the sides of your hips, the back, the front, they are being used but not as actively as the ones going forward. But we need to get those muscles on the sides of our body in this, what we call a different plane of motion, to help stabilize. So one reason is to move in a different direction to start strengthening those muscles differently. Number two is to really activate and teach your body how to use those muscles on the side of your hips. And then three, it actually helps with balance, because as you learn how to shift your weight from one foot to the next, going sideways, it will carry over to better balance going forward and in standing. So it's a multitude of things. Sometimes in the clinic, I actually have people point their feet in different directions, and the movement has to come from your hips. I might have people turn their hips totally in this way, and then they go sideways. They have to maintain that so they get a different angle of those hip muscles. I might have them really go straight ahead, because that'll actually activate the arches in their feet more. So there's a lot of reasons I have people go sideways. It's very, very important. A vast majority of the exercises I give people when they're standing is focusing on those muscles on the sides of the hips.
So when they go to the bathroom,
don't
always walk sideways to your right. Sometimes walk sideways to your right, and sometimes walk sideways to your left.
Exactly.
Okay.
Exactly.
Cool. Thank you.
You're welcome. Any other questions? Trying to think if I forgot something. Sometimes I usually forget things, but I think I got everything in the PowerPoint this time.
And you can unmute yourself to ask questions too if you don't want to type in the chat box.
So I take it you're doing in-person treatment.
Oh, good question. I'm so sorry. I didn't talk about that. Yes. We've actually been open in person since the beginning. We were allowed to stay open. Of course, last year, most people did telehealth. But since last May, almost everybody is coming in. But if someone isn't comfortable, we can do telehealth. I only have one other therapist. So typically it's me and the patient, or there's two therapists and two patients in the clinic. We're all wearing masks, we all clean. A lot of people are having their vaccine. I've gotten mine. So, but we're still wearing masks, of course. So it's not a problem.
Great. Thank you.
Great.
I'm also a Medicare provider. So if you have Medicare, oftentimes on these talks, I have a lot of people with Medicare. If you're not Medicare, we do bill other insurances as well.
Great. Okay.
So would you need a referral from a physician first? Is that?
Yes and no. Legally, in the state of Illinois, as of 3 years ago, you do not need a prescription from your doctor. However, people with Medicare, the doctor is still, we are still required to have the doctor sign off on our note. So if you have Medicare, you do need a prescription from them, just because of the way the system works. But if you have younger people who are not on Medicare, they can just come in, which is wonderful. There were so many times I'd have a woman, and then she'd call me, oh, my husband threw his back out, can you see him? And I could get him in like immediately, so they didn't have to try to reach their doctor on a Sunday or a Saturday, try to get in to get a prescription and delay their course of treatment. So it took a long time. Illinois and Texas were the last states in our country to get direct access. And so I'm proud to say that we can do that now. So yeah, good question. Thank you.
Yeah. And I also want to let people know that Denise next month is going to be talking about, on April 22nd, it's going to be healing shoulder pain naturally. So Denise has a series of talks. She does the low back pain and sciatica, shoulder pain, foot pain, and then you're also adding a hip pain, right?
Yes. Yeah.
And also, go ahead.
I think the hip pain will be in July. I think we decided.
Correct. Yep. Foot in June, or no. Yeah, I think it's foot in June. I can actually look and see. In May, we've got the heel and foot pain. And then in June, we're going to do the low back pain again. And then in July, we're going to be doing the hip pain. And you've also done for the Y balance and fall risk assessments.
Right, right.
We used to do that several times a year. We tried to do it last fall, and nobody wanted to come into the Y to do it. So hopefully, maybe this coming fall, we'll be able to start doing that again. I think that'd be really nice.
Yeah, that would be terrific.
It's very helpful. Yeah.
And also, you know, a big part of my mission as a physical therapy clinic owner, and a big part of my role is educating you on how to take care of yourself. And so I have a lot of educational information on my website. I have a YouTube channel with videos. And there's a video on how to climb stairs so it doesn't hurt your knees. And I'm proud to say I actually have like 15,000 views. I don't know how that happened, but that went a little bit viral. But there are some other videos that are very helpful, and the ebooks you can download as well. And I write a blog, and I send out an email each week with some tips. So.
Yeah, and as an instructor, I teach balance classes at the Y, and I've picked up some tidbits from Denise's programs that I now incorporate into my classes about using your core and using your transverse abdominals, because, you know, as you mentioned, a lot of the reason people have back issues is because they have imbalances or strength deficiencies in their core. And once you strengthen that, I have a client who used to have significant back issues, and she said, Karen, I'm worried that I'm going to have those again. And I said, Alice, don't worry. You can now plank for 30 seconds or for a minute this way, and you can side plank for 30 seconds. You haven't had back pain in years, and I don't think you're going to.
Right.
So, and you know, it's thanks to Denise that I learned a lot of the little tricks of the trade to teach people how to have good stability, good posture, etc. So.
Well, thank you. Yeah, I've had a couple of patients who are part of Karen's wonderful balance class. And they tell me that whatever I was teaching them at the moment that Karen was teaching them, I'm like, oh, that's so cool.
Yay, yay.
You know, I'm going to add one little piece here of information. You're talking about our core, which is all the muscles between your diaphragm and your pelvis. But something that's very interesting, because where I really started with this non-traditional therapy, this of your abdominal region is the front of your back. So I find anybody who has a GI issue, Crohn's, ulcerative colitis, IBS, almost always have back pain. And so I have to work on the front of their body, some tissues in the abdomen, to alleviate some of the pressure that's going on in the back, alleviate some of the inflammation. You know, if you got inflammation in your gut, you're going to have back pain. Okay. So I would say everybody who has back pain, sometimes they have a gut problem. Everybody with a gut problem is going to have back pain. So those are important things to look at.
That's a really good point. Yeah. And I've actually used that too, that this is the front of your back, because it holds everything in.
Yeah.
It holds you erect, which is important. And I am putting in the chat box when the next presentations that you have are. So I'm going to be looking down and doing that for just a minute. So give me a minute longer, Denise, if you want to share anything else, or if anyone else has any questions, feel free to.
Oh, you're gonna pick out a name.
Correct.
Who's gonna get the prize, and I'll give you the prize.
There you go. Do you have a name for your hip program?
Oh, nothing creative other than healing hip pain naturally.
Okay. Okay. Deal. All righty. And so let me just add that one in. July 22nd, 12 p.m.
So the interesting thing about the hip, you know, when someone comes in and says their hip hurts, I always have to ask them, where does it really hurt? Because everybody thinks describes their hip is in a different place. In other words, sometimes people say my hip hurts and it's actually their SI joint in their back. Yeah. Sometimes they say their hip hurts and it's on the side or it's in the front. So that's how we discern a lot of those things.
Yeah, kind of like when you talk about the different
back pain. I have people who come in here with back pain, and it's because their hip is so degenerated, they now have back problems, but until they take care of their hip joint, their back isn't going to get better. I have seen that multiple times. So
Sure.
it's very important that we evaluate the whole body to look at where's it really coming from.
Yeah. Okay, so do you want me to pull the names of the people who put their email addresses in? Do you want me to pull one now?
Yeah, pull one. Let's see who gets the prize, and I'll show you the prize.
All right, I need to spread out. I wrote them all down. I'm going to put them in a jar and pick one. So give me just a second while I do that. All right, there's that one, and oh shoot, I need scissors. I put them too close together. All right, I've not done this before. This is kind of fun.
Yeah,
All right.
well, I haven't either. So let me know if you like it. I see one name I recognize. Hi, Carol.
All right. Oh, and I've got to add Nancy, so give me just a second. I don't want to leave you out, Nancy. And if you still want to be added, anyone, I'm only putting the people in the jar who put their email addresses in the chat box, because I don't want, if you didn't want to put your email address up, I totally understand that. So.
I didn't put mine separately. I just put it with my answer. Is that okay?
Yes, I've got yours. Yep.
Okay, thanks.
Thank you. Okay.
So if we wanted to for a consult, you have availability.
Oh yeah. Just call my office, and Jenny will schedule a time for us to talk.
That sounds good. Do you want to put your PowerPoint back up and show people the address or the email address and the website? There you go.
So you can email me, you can phone. On the website, there will be a place that you can email from there as well.
Excellent. All right. And I've got things in the jar, and I'm going to pick one. And it is Colleen.
Who?
Colleen.
Colleen.
Yes.
Where's Colleen? Can you show your face? All right, Colleen, you get a nice manual touch coffee mug.
There she is.
And face mask.
Oh, nice.
Okay.
Yay.
All right.
Colleen, do you live near the YMCA? Are you local? Oh, you have to unmute yourself.
Yes, I'm only 5 minutes away from the Y.
So I think I'm going to
Awesome.
drop this off, and Karen, maybe I'll drop it off. Are you at the Y these days, Karen?
I can go to the Y every day. I live about 5 minutes away too, Colleen. We're probably neighbors.
Oh, okay, good.
So
I'll drop this off. I'll put it in a little shopping bag with your name on it.
Perfect. And then Colleen, I'll put it in. I'll make sure that you get it. Okay.
Yeah, and I'll
Thank
give it to
you.
the front desk, who will give it to Karen, who then give it to you.
Okay,
All right.
And maybe you can arrange a time to pick it up or something. Does that
Exactly.
sound
Right.
good?
thank you very much. Very good.
You're
Thank
quite
you. I
welcome.
enjoyed.
Congratulations.
All
And I use
right.
my mug all the time here to drink
Okay. Terrific.
tea and water. So thank you all for coming. I really appreciate it. And I hope you all learned something. And
Yes,
please
thank
reach out to me if I can help you in any way.
Thank you.
Thank you very much.
All right. Thanks, everyone.
Bye.